something just came to my mind just now, and I think I'll probably just try and share it. I mean, has any of you been to, oh, no, let me rephrase it. Grooming. I'm fortunate to have 4 gentlemen in house right now. So let's talk a little bit about grooming. And I can see over the lockdown, I stopped shaving. So I started to look unkempt. Their hair grew to a certain extent and then it self-cut itself. Now, the concept of mask again, or face covering, does it afford the same protection when you have a beard and you have a mask going over your face, knowing that a clean shave, you're likely to have a more fitting compared to, I mean, Larry, the last time I spoke with you, your beard was as big as a forest. I don't know if you managed to shave this morning for the purpose of this Zoomcast, but I don't know. I think Boye is nodding his head. Perhaps he wants to stake that part because I can see your beard. Does the face mask offer you protection when you have a beard that big? Because I've seen a lot of people walking around with a face mask, and I know for a fact that there are gaps on the side of a face mask.
You're very right in this one. I think it's again down to culture. We're very clear on this one. If you don't have any shift in your behaviors, you really will not survive this whole season. I think it's clear that it doesn't offer full protection, is what I would say, if you've got any way that it stops it from harnessing well to your face. And I think the whole essence of that is based on the fact that all these things have very light tightening mechanism, and you would expect that to pretty much be loose on a face that has a mask and that has a beard on. So yes, when the guidelines came out first, the first thing was NHS declared that we should all kind of get rid of the beard, because obviously it helped, especially with where there was an issue with fitting. So fitting of masks was a big issue at the time because PPE, however much they were being recommended at the time, there was an issue about the way it fits on people's faces. We all have different ways of our contours on our faces. So that was another big issue. And I think this is another thing about the masks we have available, is how much of that is really fitted. So the frontline people were offered fitting, while the others were kind of given the basic one. So answering your question in brief, there is that element of, yes, it doesn't give you the full protection, but it doesn't harness well.
All right. Okay. I suppose there'll come a point in time, perhaps they will impose another infringement on the rights where everybody will have to go the 24-hour shadow and come with a clean beard just to secure, I mean, God forbid the second lockdown. Perhaps there's a new government guidance or policy that might be implemented later. Let me speak from a parent perspective. And there's also a little bit of the law, or should I say the guidelines around children wearing the mask. Again, I'll throw this open. I don't know, from your experience, if some of you have got kids, I know the kids have been on some compulsory holiday, but when they do go back to school, the guidelines around children wearing masks, and again, and an interesting part as well, can children really catch COVID-19? And if they can, how are we going to be able to send kids back to school with a mask on and social distancing? So speaking from a parent concern, I don't know, some of you probably have children too old, or should I say, no, let me not expose how old you gentlemen are, but I'm sure you've come across some of the government guidelines with regard to children going back to school, children wearing masks, 11-year-olds or under, no masks. Anyone hoping to share their thoughts on this? And that would be possibly to someone who's got kids 11 years or under.
I don't have that, so I can eliminate myself based on that expected demographics. Can I just make it clear, though? It would be useful to say that apart from the mask, which I described there, I think the same thing about the beard again, the fact that people might sit in it and needs to be cleaned quite often if you really want it to be free of the COVID virus. But talking about children, I have actually seen a child that tried to wear a mask only last week, and it did not work because the standard masks we see out there cannot fit a child's face.
Right.
And clear that they will struggle. By the time they actually use the mask, it's probably reaching the edge of the ears, the actual the part that is meant to filter, and it is obviously a concern. So without fitting masks on children, you might struggle. And we're talking about the younger generation, the much younger children. In effect, if they were in school premises as well, you would expect that they'll be going in and out of the playground. Now, the whole idea is they shouldn't touch their faces as well when they're wearing the mask. It becomes very impractical. So there's one element of it not fitting, and the other one is how practical can that be? Does that mean there's no playground anymore in schools? So they become confined and they can't even engage. There's going to always be flouting of the social distancing rule as well. There's a lot more in that space. But going back to the point you raised about whether children can contact COVID, I haven't heard that COVID is not that doesn't affect children. I know that there's a less likelihood in terms of.
Why is that so? Why is that so?
Simply because I think age plays a part in this. Age has been defined as one of the risk factors, and I think clearly there are other things that adults do that children probably don't do as much of. But I think there might be a concept of where they might also have some kind of immunity that might prevent them from showing the quick cascade of decline. But it's not something that is something that doesn't have access to children is what I'm trying to say. I think we need to be clear about that. Children can contact it, in my understanding.
Okay. Let's also look at it from the notion of if you were a listener and you were anti-mask today, and your reasoning is along the line of when we wear a mask, what is the duration of the mask? So face covering and mask again. Face covering, what sort of duration does it afford us to keep it on before it gets contaminated, knowing that bacteria comes out from the mouth? And so in most cases with the face mask, I don't think it's very clear for people to understand how long can you have it on and how often do we need to change the mask. That's one angle. So there's the prospect, because I do know from little reading that I've done, it's also becomes very dangerous to have putting a mask on that's already contaminated. As a matter of fact, I've had few clips sent to me, although from abroad, where people are actually going to the extent of now recycling face mask, not face covering. So it offers the notion that because there's a shortage of some of these masks, like it was in the beginning, people are actually picking up old masks and they're washing it and they're putting on a lining to dry up to reuse. I would like to have some sort of should I say, insightness into why or what are the risks with using a contaminated mask. Does it make us prone to pneumonia? Can the lungs get infected? That's one angle. I think another angle looking at it will be also how long can we keep a mask on, knowing that, yes, it's okay if someone said don't drink water. I think as a human being, you can survive for a length of time, or perhaps a couple of days. Same with food if you didn't eat. But when you have the mask on, what is the recommended period to keep the mask on before you start to deny yourself of oxygen, and then your saturation level will drop? Again, it's a question I'm going to throw open to anyone. I see you boy is smiling. I'm not sure am I stepping out of line, but the question is open to anyone. Happy to address it.
Well, if I may, in terms of the oxygen level, I think it's subjective. It depends on the individual. Some people have medical conditions.
Yeah.
I'm not a doctor, but from a logical perspective.
Speak up a little bit, Larry, please.
I said I'm not a doctor, but from a logical perspective, I would say that if you've got asthma, or if you've got certain medical ailments, you may not be as tolerant to lack of oxygen or restriction in getting your oxygen level. So I think it's more subjective. One rule for all, I don't think is the case here. I think you need to look at a particular individual and make your decision from that. So that's my view. I don't know if all the medical experts can say, but that's what I've observed.
For me, I'm just using myself as an example because that is the issue I have about mask, is that it makes me uncomfortable, very uncomfortable. I start losing breath within 15 minutes of wearing it. So, and I've not been diagnosed of any.
So you don't have any underlying health factors?
Issue.
You sure? You might want to go back to your doctor, Emmanuel.
Well, Well, the last time I checked, I still had a clean bill.
Okay.
But I struggle with that. I noticed that my breathing level goes down. So it's something that I have, been struggling with, and that's one thing that I have with wearing that mask. So personally, it has not worked for me. So I'm one of the people who would put it on and put it off as soon as that it becomes possible.
Okay.
Can I just say quickly? I know I'm taking extra time. Someone like you, someone like the gentleman that just spoke now. You would have been fined £100. Okay, if you turn around and say, "Well, there's nothing wrong with me, officer. I have no underlying medical condition. I just feel uncomfortable wearing it." That would have attracted £100 fine. And if you don't pay that £100, you will be convicted probably in the magistrate court. So these are the things we're talking about. You don't have a medical condition, and yet if you have a medical condition, then that would work. You have a medical note from your GP. I've got asthma, I've got this, fair enough. But someone like you would have been fined because there's no excuse for not wearing it.
Can I just interject on that one? So I think, yes, you're right. I think one of the biggest problems we've found in the whole assessment of risk with regards to COVID is there's a poor understanding of well-being, which relates to the mental frame of mind. I think we look at the physical so much, and we forget that even as Emmanuel described, he's kind of prone to anxiety for not being able to breathe, and that in itself causes him some kind of discomfort. Now, it's easy for anyone to say that, well, he doesn't have that as a feature of his of mainstream condition, but the truth behind it is we've kind of not addressed the well-being of that gentleman, which leads to his own, that's a health issue for him as well. So I think these are some of the things that came out in the whole assessments we've done. And I think NHS is, however we've used the scripts that defines what should be expected, it doesn't take into consideration on other people's anxiety. And those are the kind of people that would definitely flout the guidelines because they don't feel comfortable in it. So I'm just putting that out there so we can bear that in mind.
Well, sorry, I think we're missing the point. There's a difference between guidelines and the law. There is a law in place. It's not the guidelines that if you do not wear it in public places, you will be fined and you will get convicted. That's not the guideline. The guidelines is something different. And that's the one I take issue with, the law forcing people to wear it and fining them and convicting them.
And is that sustainable in the long term? How many people can we go after?
Well, the safeguards that the police have in place is they will talk to you. Oh, mister, could you please, can you wear it? And, and if you say, no, I'm not wearing it, I don't believe in all this melee or this Covid19 stuff, I'm not wearing it, then they will fine you. But if they put safeguards in there to talk to people, carry them along, and if they don't, then you fine. That's in yeah.
All right, Emmanuel, I have a question for you.
Okay, just before you go, just 1 minute.
Okay.
Just 1 minute.
Right.
We'll be doing this topic a very, very great disservice if we are talking willy-nilly without actually referring to the frontline workers.
Right.
I'm talking about nurses in hospitals and in care homes. Do they have to wear a mask when they're dealing with COVID patient positive?
Yeah.
That's what we need to think about. It's okay for us to say, yes, we find this mask very uncomfortable. I don't want to wear it for 4 hours. But what they're saying is they are not asking you to wear it if you're walking down the high street. If you go inside the supermarket, they expect you to wear it. And nobody stays in the supermarket for more than 2 hours. And secondly, to your question about those that need to wear the mask, they're nurses. They do carry a risk assessment. And any nurse that is looking after a COVID positive patient, they are supposed to be fully geared up. And they are not allowed to wear the mask not more than 4 hours. It's going to be less than 4 hours before they change it. And they carry a risk assessment. When they are fully geared, they test whether they can still perceive the sense of smell is still working. Once they can smell that face mask or gear they're having on, it's discarded. It hasn't worked. So when you're fully geared, you are not supposed to pick up any kind of smell. So the slightest smell that you pick up, that gear is thrown apart. And to answer your question again, they do not wear it for more than 4 hours, and that's it.
So the general public. So
I'm not talking about general public now. I'm talking about those in the front line.
Fair enough.
Who run the risk of contracting this disease by attending to those that have already contracted the disease. So we have to bear in mind that they have to have a form of protection, not any kind of form of protection. We know the nurses have died, people that work in care homes. So I'm talking about this kind of people now. I'm not talking about the general public whose life are not at risk if they don't wear the mask. So my concern now is those frontline workers, NHS, both in care homes and in the hospitals, who have to deal with this COVID positive patients. They have to be protected. So that is my concern. And we're not going to be doing this topic any justice without looking at it from their point of view. They don't have a choice. Whether it's convenient or not convenient, they have to be prepared to save lives and in saving their own life are following this guideline, making sure they are fully clothed, they fully wear the gear. So that's my point.
I'm sorry, John. I just want to make a point. I'm sure there is no institution that I know of in the UK, definitely, that hasn't carried out the risk assessments for their frontline workers. Because we fed back to this, and I think every organization has been tasked to report on how many people they've done risk assessments for. I think you're right. I think, yes, they're the people that are most likely to contract with other people they're dealing with. However, I think the way we look at the R factor, really, you're looking at the ones that are actually in the public domain, because the people that are under controlled measures are more likely to be tested, they're more likely to be checked upon, and they're more likely to be brought into a space of quick intervention because they work with those patients. So it's all about the regular testing of these people, and I believe that most organizations are doing that. I may be wrong, but I speak from a point of what I've heard from other organizations about the BAME group. And I know for a fact that they've said the testing has actually taken place in all organizations in the UK.
All right. Emmanuel, let me come back to you quickly on
I'm going to qualify something, NHS, I'm afraid. So I do apologize if I'm saying that broadly, as if NHS is the only place that are frontline workers. The other frontline workers apart from NHS. But I do appreciate that.
Okay. Coming to you, Emmanuel, briefly, and something just occurred to me. Earlier, I think you mentioned a valid point, and I'm just wondering how much knowledge is out there for the general public when it comes to, because I know there's a balance between face covering and face masks. Now, the face mask itself, how much knowledge is out there for the general public to understand how to discard used face masks? Face masks, yeah, because face covering, I think if you have a face covering that is made out of fabric that serves the purpose, you have the opportunity to take it home and get it washed. But with the face mask, once it's been used, it's been discarded. Now, I don't know if any one of you have noticed, there is no day that I go out that I don't find a few, not one, not two, not three, face masks being dropped. As a matter of fact, I've observed people going into shops, because now what you get is some of the shops, if you don't have a face mask or a face covering, they will offer you one at the point of entry. Now, what people do, go in, do the shopping, and as soon as they leave on the way out, either it's intentional or not, you find that the mask will find its way to the floor. Are there enough information for people to actually understand that in the quest of saving ourselves, we're also destroying the planet by not properly discarding those masks? I know for the hospital setting, they will have, I think it typically comes on the yellow bag where they discard PPE, but the general public, for this instance, do they have those guidance out for people to understand? Or this is just a bad behavior on the part of the general population? Emmanuel.
From my observation, that there's little or no information about how to dispose face masks.
So we put it down to common sense then, or what?
It is, that's what it is. And it depends on how knowledgeable you are in terms of understanding what the impacts are. First of all, that is a plastic material that it causes the same problem as the usual plastics that we have. And also the unhygienic nature of that as well, to make sure that you dispose it appropriately. But what you say is many people just discard it indiscriminately. Like I explained before, some people just chuck it away in recycle bins, because when like my daughter will always put wrappers that feel like plastic into recyclable. That's the way some people feel it. It's plastic. You put it into recyclable. It's not a fault of theirs because that's what they think it is, a plastic, that it can be recycled. And some other people dispose it anyhow. So there's no direction to people on how to dispose that, explaining the risks involved if you don't.
All right. Okay. Another question that comes to mind is essential services. I mean, who actually advises the government on the basis of what we would categorize as essential services? Again, over the lockdown, I learned to enjoy a shot of whiskey once in a while, discreetly, not that anyone got to know. Thankfully, I didn't become an alcoholic during the whole lockdown period. But I don't know if anyone have noticed throughout the whole lockdown, liquor stores were opened. Liquor stores were not closed during the time where we actually had a total lockdown of services. What makes a liquor store an essential services or essential goods? So we did struggle with the initial, when people went out to buy loads of tissue paper, we overcame that. And I think what was the other item that people literally started stock buying? But alcohol, liquor stores remained open throughout the whole period. That's my personal observation. How do we come to those sort of conclusions? Larry, you're smiling.
Well, to be fair, I've not observed myself.
Has anyone observed that liquor stores did not close throughout the whole lockdown?
No, if this shop alone sells only alcohol, they will remain closed throughout the lockdown. The ones that were able to enjoy those facilities, they sell other grocery items. So they were able to hide under that canopy. So they remain open because they were selling essentials like bread and milk. And people were not going there to buy bread and milk alone. While they were there, they were getting their boat of, I don't drink alcohol, but they were getting whatever they wanted to get. So it's like killing killing three birds with one stone. So there was no tight guidelines. If you walk into any of those big supermarkets, you're going there to get your bread and milk, and you walk to the alcohol section, you can pick it up and pay at the tills. But if you have mainly the salt alcohol alone, they are meant to remain closed under the government guidelines. So
John, you don't drink alcohol. What do you drink then?
I drink water.
You drink water. You don't drink orange juice?
I do drink orange juice.
Orange juice is worse than alcohol.
So says you. Are you a doctor?
Okay, I think we're starting to exhaust the whole notion. And what I'm picking up from this is that it's still, we can't have enough conversation around the response to COVID-19. I mean, interestingly, these are really trying times. I'm not sure if anyone has any additional points to raise just before we start to wrap up. We've gone an hour already, and I think it's only going to be fair for me to allow you gentlemen to carry on with your Saturday. Do we have any additional points that we want to raise before we sign off?
All I can say is we know what we know.
Yeah.
And we have to, as a group of experts and specialists, the Public Health England and the Scientific Advice Group of the government, we need to work together. By working together on what we know, that will lead us to what we don't know. And in cracking what we don't know, we'll be able to come up with robust measures and countermeasures that will help in saving lives. Thank you.
Boye, any closing remarks?
Well, I just think on the backdrop of a financial crisis, I think we need to be mindful of how the whole easing of the lockdown and all those things, how they're going to pan out. I think no doubt everyone wishes to be in a good place, but it's they're driven by other factors. And I think financial challenges is a big factor. And this is where the human response to these things can actually cause us to move away from guidelines and to follow what you call self-mode of coping. Thank you.
Larry, do you have any additional points to add?
Yeah, from a legal point perspective, I think we must do things within the framework of the law. We cannot, because of COVID, again, I reiterate, destroy and drive a coach and a horse through our entire civil rights or civil protection I think it's a proportionate measure. A proportionate measure should be taken, where we shouldn't panic. At the moment, we have a parliament that is sleeping. Anything we put before them and caption it as COVID, they will sign it. So the only people that will probably stand up and say, oh, hold on a minute, you can't destroy everything because of COVID, is probably the courts. But because it's early days, wait and see. There will be several cases coming to court where people's rights have been trampled upon, and we'll be having another discussion where we'll have to say again to Boris, like you did in the Brexit, where the Supreme Court said to him, Mr. Man, let Parliament determine. Again, we're going to have cases coming to the courts where the court will say, you've gone beyond what you should do, get back in line. And that's my point.
All right. And Emmanuel, would you have anything just to add?
Yes, what I would like to add is that I would like a situation where the government and everybody who has influence should promote reusable masks, to try and educate people. Let the single-use mask be left for the frontline
Workers.
Yes, let that be left for them, because they will be able to dispose it appropriately. But for the general public, let there be that promotion of reusable mask. But because if we don't, what we're doing is that we should know that single mask makes an ecological time bomb, which, if you look at the lasting environmental impacts, and that is a consequence that will be for our planet. Thank you.
Okay. I think it will be, at this point, I think it would be a perfect time to sort of end the Zoom, purely because I do understand that it's a Saturday. You guys have worked very hard throughout the week. And I know that you usually have your little activities to get up to on a Saturday. So I think on this note, obviously the conversation is ongoing. It's never ending. We need to have more of this kind of conversations from different angles. I felt it was important to address the key difference between the face mask, which forms part of the PPE, and the face covering. Initially, for me, my personal opinion, I actually thought it was a waste of time wearing a face covering. However, I'm starting to appreciate the reason why a face covering will also serve a purpose. So on that note, I'm going to say thank you to all of you individually. Boy, thank you very much. John, thank you very much. Emmanuel and Larry. I look forward to speaking to you guys after the Zoom, hoping that we've enjoyed this session, and there will be a series of sessions to follow. And if anyone in the general public happens to consume some of these things that we've spoken about today, please check us out on our social media. We're a very small talk radio podcast going through the teething stage and the early days. We're growing organically, so we don't have a huge number of followers. We purely discourse about social issues and issues that affect the local community. So on that note, I'm going to say thank you for being part of Entire Media Connect, and I look forward to speaking to you gentlemen soon. Thank you.
Thank you.
Thank you.
Bye.